Good morning, everybody. Here's Taiwan, and I'm glad to attend the conference of the 10th edition webinar on breast cancer. I'm Dr. Jen, and the topic I would like to share today is the maintenance effect of acupuncture on breast cancer-related menopause symptoms. Here's the website of the webinar on breast cancer. Due to the issue of COVID-19, many conferences need to take online. So I hope one day we can join together on site so that to share more information together. And here's my introduction. I'm from Taiwan. I'm an oncologist, work for Taipei City Hospital, and I also assistant professor of the National Yang-Ming University and majored in traditional medicine. So the topic today is the effect of acupuncture on hot flush and menopause symptoms in breast cancer. And we want to conduct a systemic review to see how acupuncture works in this issue. So as we show in the slide, the estrogen or hormone play an important role in breast cancer, and prolonged estrogen stimulation will increase the risk of breast cancer. For premenopause women, some breast cancer patients need anti-estrogen therapy and start menopause phase earlier. And for those postmenopause women, an increased risk of breast cancer among users of menopause hormone therapy were noted. So actually, to treat breast cancer, we would treat them according to their estrogen receptor negative or positive. For those who with the estrogen receptor positive, we would trigger the menopause status so that the patient won't receive estrogen stimulation. We use some medication for premenopausal women. We want to trigger earlier menopause, so ablation of ovarian function was applied, combined with tamoxifen. And for postmenopausal women, we use the aromatase inhibitor or tamoxifen to maintain the menopause status. So when we trigger the menopause status, the estrogen will decrease, and it will trigger some discomfort symptom because it affects the hypothalamus axis. So here we see the menopause symptoms include vasomotor symptoms such as hot flush or increased sense of fatigue or increased fat deposition, which lead to obesity. And these all increase psychological distress and mood dysregulation. So the epidemiology rate of the breast cancer, we can see more than 60% patients will have the climatic symptoms, just like hot flush, insomnia, joint pain. And here's a list of menopause symptoms include the night weight, loss of libido, hot flush, or fatigue, or even incontinence and joint pain or burning tongue. And there are some tips for dealing with these menopause symptoms, which includes avoid spicy food or eat more whole grains and sleep more, exercise more, and maintain a healthy weight, and more. Some people will adopt the complementary therapies such as yoga, massage, or acupuncture. So how acupuncture works in breast cancer? In WHO's data, we noted 80% of cancer patients use CHIEN in one form or another, and acupuncture is just one of these. The most cases we applied acupuncture include lymphoedema post-surgery, insomnia, or aromatase inhibitor-related muscle and skeletal symptoms, anxiety, or even hot flush and menopause symptoms. In previous time, we have published some review article to survey the acupuncture's efficacy in treating aromatase inhibitor-related arthralgia or even hot flush and menopause in breast cancer. And this topic, we want to evaluate the maintenance effect of acupuncture on breast cancer-related menopause symptoms, because sometimes acupuncture short effect, but whether it's the effect will maintain or prolonged, we're not sure. So here are some articles in the website of the news that BBC also interested in acupuncture because more and more Westerners adopt this claim. And here we see it, breast cancer patient who hesitate to take hormone therapy for the side effect of hot flush and menopause symptoms will lead to the increased rate of recurrence or loss of disease control. So if we can apply this technique, acupuncture, to make patients suffer less from this side effect, then they will have much more compliance with the hormone therapy. So how the acupuncture applied in this issue? The most frequent protocol is biweekly for 2 or 3 months, and we want to let patient have a dirty sensation, what we will explain later. And we apply the acupuncture according to the Mandarin theory, and acupoint selection is followed TCM theory, not consistent in varied trials. So what is the qi? It is translated from Chinese words. Dirty is a sensation when we insert needle to the acupoint, a tinkling, numbness, heaviness, and other feelings that occurred after an acupuncture needle has been properly placed in the body. The needle may be twiddled, moved up and down at different speeds and depths, heated or charged with a small electric current until the qi sensation occurs. So we can see qi refers to the excitation of qi, or vital energy, inside the meridians by acupuncture needle stimulation. Patients often experience multi-dimensional and intense needling sensations such as numbness, soreness, distension, heaviness, dull pain, and sharp pain during acupuncture stimulation. Qi is considered as an important parameter in the process of achieving therapeutic effectiveness in acupuncture treatment, and the mechanism may come from neurophysiological or neuroendocrine. So here we'll review the charts about acupuncture applied in hot flush and menopause symptoms. Totally 30 randomized control trials were included, and it included 943 patients, all within medium to high quality. The randomized control trials quality assessment will use the GRADIAT score, and in these trials, the sample size varied from 31 to 122. And in control arm, the treatment are varied, include applied relaxation, CHIEN acupuncture, hormone therapy, or even medication such as carbapenem. So when it comes to the outcome measurement, it's not consistent. Majorly, they use the hot flush frequency and severity or the primary outcome measure. And the secondary outcome measured, most trials applied menopause symptom by using the Kaplan index. The Kaplan index is a questionnaire that patients to self-report how they feel about the menopause symptom. The rating score range from 0 to 3, and the more score means the more severe of the symptom. These symptoms include hot flush, weight change, insomnia, depression, fatigue, muscle pain, headache, and vaginal dryness, and even forgetfulness. It is the table of the complement index what measured. So here we see the result. About the frequency of hot flush in all the trials we concluded. There are 4 trials we analyzed. We used the 4-risk plot to demonstrate that no significant effect in long-term relieving frequency of hot flush was noted, even though they have some short effect after each timed intervention. And when it comes to the severity relieving of hot flush, there are only 2 trials that we can apply the meta-analysis to estimate it, and no significant effect in long-term relieving severity of hot flush, but they have some short effect. So even though we noted that when it comes to the symptom relief, the 6 trials we analyzed noted significant improvement of the menopause symptom was noted. The p-value have the significant level, means patients who receive acupuncture suffer less menopause symptoms. And this menopause symptom could be categorized in 3 respects, including autonomic nervous system disorders, psychological symptoms, or other symptoms. So here we concluded that in long-term effect, which means not in each time's intervention after acupuncture, but in maybe the 3 months or 2 months in each trial, it varied. We noted acupuncture has no significant effect in relieving frequency or severity of hot flush, but it did has improved the menopause symptoms significantly. So we want to know the possible mechanism of the acupuncture to apply in this issue, and we surveyed and do a lot of research which revealed that acupuncture could modulate autonomic nervous activity. In Chinese medicine, we see it can reconcile the yin-yang imbalance, and it's probably by applying work through the thermoneural zone of women undergoing menopause may be narrowed down due to elevated sympathetic activity, thus resulting in hot flush and elevation of core body temperature. Another possible mechanism is that acupuncture might upregulate the parasympathetic system, counterbalancing the overexcited sympathetic symptom and thereby relieve menopause symptom. So in TCM theory, we see it if we applied yin with vagal and yang similar to sympathetic, then much great increase in energy of the yin meridians than in the yang meridians, which correspond to the greater increase in vagal tone than in sympathetic tone as shown by HRV analysis. So a dynamic balance between yin and yang were noted, and this dynamic also apply in vagal and sympathetic system. And if it gets balanced, we call it as a harmony status. So from TCM's perspective, the acupuncture could also promote the chi flow along the meridians. We said that it drains the meridians and channels. All in all, the acupuncture's mechanism involving nerve system, vascular system, yang delivery tissue, and organ system. From TCM's perspective, it's reconciled yin-yang, which leads the illness to a balance when the yin-yang or vagal and sympathetic tones get balanced. So when it comes to yin-yang, in some culture, it has applied yin-yang in language, and in Chinese, it's applied in medicine and even in life. The yang makes similar to qi, energy, activity, and the yin is similar to matter, fat, body, blood, and body fluids. So from another perspective, another possible mechanism about neurotransmitter, we see a reduced level of endorphins promote the release of serotonin and norepinephrine, which contribute to a decline in the set point in the thermoregulatory center of the hypothalamus and triggers hot flush and vasomotor menopause. So the acupuncture could block this change. It can stimulate secretion for endorphins, and which let the menopause symptoms not so severe. It is the hypothalamus regulated figure demonstrate the endocrine theory. Some studies advocate that acupuncture alters the level of key menopause-related hormone, estradiol, FSH, and ALG, and it's very complicated. So from neurophysiological theories, and it which involve the pain management, if acupuncture could have some effect on these pathways, and it can alter the pain sensation, which had been studied a lot before, not only in breast cancer issue. So when we reviewed how acupuncture worked in the PubMed in some clinical trials, we found it had applied more and more in breast cancer, and the top 10 clinical conditions being studied in oncology acupuncture trials were pain, quality of life, fatigue, nausea, vomiting, hot flush, astrostomia. So, as I am an oncologist and I also practice Chinese medicine, including acupuncture in my clinical life, I found the most case the acupuncture work is lymphoedema or some musculoskeletal symptom related to aromatase inhibitor, and even anxiety, insomnia, menopause symptoms will have response to acupuncture. So here's a website of British Acupuncture Council. We see acupuncture can be effective in treating hot flush and also anxiety and depression related to menopause. So in Western medicine, there's a field overlapping with the CHIEN, and here we call integrative medicine, also integrative oncology, and what we discuss is the oncology acupuncture. So in the NCCN guideline, acupuncture has been recommended in dealing some problems include adult cancer pain, anti-emesis, cancer-related fatigue, and palliative care. So this picture is from a scientist. I think it's very interesting because in the left one, it demonstrates a molecular picture. And the right side is demonstrate Chinese people vigor, and is a yin yang which demonstrate harmony with a dynamic balance. So here is my topic today to share the acupuncture in breast cancer related menopause symptoms. And many thanks for your attention. And should you have any problem, please contact me with this email address. Thank you.